Here's what most caregivers don't realize. Getting someone to a mental health appointment isn't just about the logistics. It's about solving 5 problems at once. And transportation barriers are making every single one harder. After 20 years in medical transportation, I've watched patients cancel therapy appointments because they couldn't face asking for a ride. Others show up late because coordinating pickup around anxiety triggers felt impossible. And some never schedule in the first place because the thought of depending on a stranger to get them there crosses a line they're not willing to cross. The barriers aren't what most people think they are. First, there's the logistical barrier. Mental health appointments often happen at inconsistent times, weekly at 3 p.m., then bi-weekly at 10 a.m. Public transit won't reliably get you there on a fixed schedule. Medicaid transportation can cover it, but you have to book it days in advance, and by then, your motivation's gone. Second, there's the privacy barrier. You don't want your neighbors seeing you get into a medical transport van. You don't want to explain to the driver why you're going to the psychiatrist's office. For people managing depression, anxiety, or trauma, that visibility feels like a violation. Third, and this matters, there's the reliability barrier. Missing a mental health appointment because your ride didn't show up sets your treatment back weeks. Miss 2 in a row, and your provider might discharge you from their practice. You need a system that gets you there, period. Here's what actually works. Specialized medical transportation that understands mental health logistics. If you're already Medicaid eligible, your state's NEMT program covers mental health appointments the same way it covers dialysis or physical therapy. You book it, we show up. No explaining, no judgment. The driver is trained to understand that you might need to sit in silence during the ride, or that you might be going through something that's made mornings difficult. If Medicaid doesn't cover your situation, subscription-based medical transportation services offer fixed weekly or monthly schedules. You know the driver, you know the time. Predictability is therapeutic in itself. And if you've got private insurance or out-of-pocket coverage, rideshare services designed for healthcare, Lyft Healthcare, Uber Health, now integrate with mental health providers' scheduling systems. The appointment is confirmed. The ride arrives automatically. But here's the real conversation we need to have. Asking for transportation help isn't weakness. It's a barrier removal. It's what gets you to the appointment that keeps you stable. Full stop. If you're managing this right now, whether you're a caregiver trying to get a family member to their appointment, or you're the person on the other end of that anxiety, there's a solution designed for your situation. Check beyondride.com. Your mental health matters. Your transportation shouldn't be the thing that stops you from getting there.